The future of healthcare has turned into a battleground here at Queen's Park. A public servant has been fired. The OPP called after those leaked documents that the NDP revealed last week. Well, that had the PCs denying that they were going to privatize healthcare, and they're denying it again today after the NDP reveal even more of those leaked documents.
They were covering up the fact that Ford's overhaul of Ontario's healthcare system is a done deal. This scheme is an unprecedented opportunity for private, for-profit corporations to get their mitts on our healthcare system.
Here are the latest leaked documents released today by the NDP. They show what they say is a list of services to be outsourced: inspections, laboratories, licensing, devices, and Orange Air Ambulance.
Look at Walkerton. I mean, when you worry about things like licensing and that going into the private sector, I mean, all you need to do is look at examples like Walkerton.
The documents also seem to indicate that despite the health minister's claim they're still consulting about the future of healthcare, on January 16th, Cabinet approved a massive structural overhaul called the Full Integrated Care Transformation Plan that would create a super agency and appointed 3 board members to oversee it. The government is also warned of risks in the document, including service disruption and labour disruption, specifically with nurses.
Mr. Ford is not telling the people of Ontario the truth, nor was his health minister.
Not so fast, though. The health minister held a news conference a short time later and said she's never even seen most of these documents.
We will not be privatizing any of the services referenced today by Andrea Horwath. In fact, the document that she released today was an internal, nonpartisan public service document, which I have never seen.
The minister went on to say she isn't sure what Cabinet approved and insists they're still in consultations. She did, however, acknowledge overhauling the healthcare system could be bumpy.
The system is massive, and here on one page it talks about risks and service disruption and potential labor disruption. Do you acknowledge that? Do you agree with that? Is this overhaul going to be very tumultuous and put some patients at risk of falling through the cracks?
No patients are going to fall through the cracks. There are always issues with any kind of transformational change that you're going to bring forward, and some people don't like change. But what the people of Ontario are telling us is that we must have change. The status quo is not an option.
Now, Minister Elliott left that conference just seconds later quite abruptly. A spokesperson later came to my office here at Queen's Park and assured me that the government is not considering expanding private delivery of services. And it's not clear when the final legislation will be introduced. That's truly when we'll be able to tell what is and is not in it. As for that public servant who was fired, well, the acting Secretary of Cabinet sent out a letter to all public service employees saying that a breach of confidentiality has been broached, and we are not sure at this point yet, the OPP has not responded, if it's going to investigate.